Good afternoon and welcome to Bariatric Friday. My name is Kamal Arkan. I'm the chairman of American Surgery Center as well as United Medical ACO. I'm here with Dr. Aziz Erigao. Dr. Erigao, how are you doing?
I'm doing great, Kamal. Thank you for having me again on another session of Bariatric Friday. As we haven't had a chance to introduce me, in the past few sessions, I'll just go ahead and let people know that I am the president and co-founder of CHRIAS, which is the Christiana Institute of Advanced Surgery. My specialty is bariatric surgery or weight loss surgery, which I have been performing now for over 20 years. And with my associates, our practice actually is the most experienced practice in bariatric surgery in our area.
Thank you, Dr. Erigao. And this is a platform for us to put our support for morbid obesity for those who are going through the process of bariatric surgery or for those who already have the surgery. So this would be pre and post surgery, and that's why we are doing this. But while we are covering these issues at the same time, we find some other issues maybe related to what we discuss from different angle. So we normally have standard topics that we want to cover, and that happens in the 13, 14 different weeks. But every once in a while, either we add a new one or we maybe stop what we are doing and kind of take a little detour and discuss this maybe new issue. And interesting enough, there were a couple weeks I have seen this odd behavior from a couple of our patients where they finish this big process, 14, 15 checkpoints, and they are about to get their surgery and then they stopped. And then maybe 2 or 3 happened in the last 3 weeks, I would say. But when we have our providers meetings and when we discuss the issues, one thing that was kind of not on our radar, maybe Dr. I also didn't pick that up right away, this news that many people, they don't read the really important news, but this kind of gossip TMZ-like news, which you get familiar with the TMZ last night. So they do get a lot of attention and people talk about it. So I'm talking about Lisa Mary Presley. And everyone knows who she is, because we have to kind of know, we are forced to know everything. But one thing that probably bothers us from our surgery center standpoint, from our practice CHRIAS standpoint, but also we are the local chapter of ASMBS for Delaware. And Dr. Erigao, you are the president of that institution. And we have social responsibilities to address these issues and the myth and what's real, what's not. And I think this is the best platform to discuss some of those and clear the air in terms of what really went wrong with Lisa Mary Presley. So, Dr. Erigao.
Absolutely. Thank you for that, Kamal. Of course, it is important for us to continue what we do in terms of educating people about bariatric surgery. And as you mentioned, the news on Lisa Marie Presley's passing, which happened really in about 6 months ago, right, or more, on January 12th of 2023. But the autopsy was released by the Los Angeles County medical examiner only recently. And that autopsy revealed that the cause of death included bowel obstruction related to previous bariatric surgery. So obviously that is the information that most news outlets have divulged. I doubt that many people have had the chance actually to read the actual coroner's report, but that's what people hear. And the question is, can somebody die from a complication of bariatric surgery, particularly bariatric surgery that has occurred a long time ago? And that is something that is really part of what we discuss in our sessions, because we discuss the benefits, the advantages of bariatric surgery, but in our sessions, we've also discussed possible complications, possible risks of bariatric surgery. And certainly bowel obstruction, bowel blockage is a potential complication, particularly of some types of bariatric surgery. So it is important for us to discuss this and try to elucidate the issues that have led to the very tragic passing of this young person, Lisa Marie Presley. So essentially the first question, Kamal, is, what is bowel blockage, and is that something that happens after bariatric surgery? Certainly. So bowel blockage is a situation where the normal transition of contents within the intestine essentially is blocked. So you have to think of the intestine as a pipe, and water or some other substances flow through that pipe. And if you put an obstacle in the flow of that substance, then there will be blockage in that pipe. And then if there is pressure for things to go down, obviously that pressure will build up. And it's the same with our intestines as well. The natural flow of substances can be blocked by a number of factors. And if that occurs, medically we call that bowel obstruction or bowel blockage, right? So one of the potential causes of bowel blockage, Kamal, is scar tissue that can occur after abdominal surgery, not just bariatric surgery, but any abdominal surgery. And that abdominal surgery could be something like hysterectomy, which has nothing to do with the intestines, right? It could be gallbladder surgery. It could be appendix surgery, but it also could be bariatric surgery. So in principle, any type of intrusion into the abdomen by the surgeon to do a particular procedure will lead to scar tissue. It's almost like a normal reaction of our body to surgery, right? And this scar tissue is almost like a form of a spider web, right? It expands in different parts of the abdomen, and very often it doesn't actually interfere with the function of the intestine, but sometimes it can catch a portion of the intestine in such a manner that bowel blockage can occur, right? So what happens in the vast majority of cases, Kamal, is that when there is bowel blockage, the person will start having symptoms, right? The first thing they might feel actually is some kind of bloating, right? I feel more full than usual. And that can slowly progress into, having nausea, perhaps even vomiting, abdominal discomfort, and then obviously they will also notice that things are not going downwards, so there will not be passage of air or of gas or bowel movements as well, right? This, in general, Kamal, is a protracted process. In other words, the person starts feeling these symptoms, and then slowly the symptoms can get worse if that bowel blockage is not improved. And normally what happens is people will end up going to see their doctor or to the hospital. X-rays will be done. X-rays will show the bowel blockage. And in the vast majority of cases, the person will be put at what we call bowel rest, which means they don't eat or drink anything. They will be given intravenous fluids, and their doctors will watch them for that obstruction to work its way through. And the vast majority of times it does. If it doesn't, then a surgeon will be involved to do surgery to relieve that obstruction. So in the vast majority of cases, really a person passing from this obstruction would be unusual. And I'm talking about any type of surgery now, whether it's appendix, whether it's hysterectomy, or whether it's gallbladder surgery. Okay. Now, of the types of bariatric surgery that we do, Kamal, the ones that are associated with more chance of a bowel blockage, right, particularly of the type that probably Lisa Marie suffered from, are the bypass operations, so gastric bypass or the duodenal switch, where there is actually the surgery itself entails moving the intestine from its natural position to a different part. So when we do bypass, essentially we're dividing the intestine, and a portion of the intestine is then reconnected to the stomach, which also has been divided. This almost unnatural transportation of the intestine puts the intestine at risk for twisting, for scar tissue to form, and therefore for bowel blockage. Okay. Now, an important distinction in this type of bowel blockage, Kamal, is that there could be twisting of the intestine as well, not just blockage. And that twisting can impact the root of the intestine, which carries the blood vessels. Now, if the blood vessels are blocked, which means the intestine is not just blocked now, but it doesn't have blood supply, which means it can start to die. And critically, if this happens acutely, if there is an acute twisting of the intestine, the bowel can start to die within hours of that happening, within hours. But the person usually will have a lot of symptoms in this case, particularly in this situation, the person will have severe pain for some time. And what is odd about the situation with Lisa Marie Kamal, when I looked at the reports, is that she was having abdominal pain perhaps some hours before she collapsed and she was taken to the hospital, which means that there was time perhaps to get help at that time, right? But there are a number of factors that are really not clear at that time. And one of them would be, why wouldn't she seek help, with that happening? Well, people talk about the fact that she was taking chronic pain medications, for instance. And if you're taking chronic pain medication and you have pain, perhaps the tendency would be to take more pain medication to medicate yourself, right, instead of seeking help. If that has happened, obviously that would have been disastrous, because then hours are passing and the intestinal blood supply is lost completely. And by the time she reaches the hospital, the intestine is dead, and that can cause, obviously, the passing of that person.
There for a little bit, because in this show, I don't have the same obligations that you have. So you're a clinician, you're a licensed clinician, and I'm not. Sometimes that works against me. Sometimes that's my freedom. So, and you are saying this very nicely, where she took some. What did you use something for the medication?
Yes, some narcotic medication, and maybe
you said it very softly. So she was a drug addict. So she was a very heavy drug addict, was in the rehab for so many times, and just it's not like drug addict with 2 opioids a day. She was abusing this, and she was in trouble for this so many times. So before she died, all the news is around like the opioid use, how bad the drug addiction is. Then come back and say that this happened because of the bowel obstruction. I think it's the drug companies controlling the media, and they don't want that part to come out. And they are just trying to blame this. That's my opinion. So I know you don't have to agree on this, or you don't have to, confirm what I'm saying. But the news changed 7 months later to bariatric surgery. But before that, like you can, Seattle Times, People's Magazine, TMZ, so many different references. It's all about drugs. No one talked about her bariatric surgery then. Now, is it the best thing that was she the right person, right candidate for bariatric surgery? We can discuss those in different settings. But if I have a nose job, like my common example for this event, and if I'm heavily using narcotics, guess what's going to happen? I'm going to die from some complication of the nose job because I'm not able to respond to that. So I'm not able to communicate my symptoms because I'm numb. So it's all about prevention. It's all about early diagnosing it earlier. But no one said that this was an issue that she reported. It didn't just happen, so it can develop in time, right? You can correct me if I'm wrong. So this just didn't happen overnight. This would bother her. And if she did come to us early on, right after the surgery, she wouldn't die. She wouldn't have to die. So this is a curable problem only if you communicate. And if you don't communicate, number one. Number two, you're a drug addict. Now, I'm not going to use the correct version of this. If you're a drug addict, don't get a surgery from anywhere. Please stay away from our program because things are going to happen to you. And then Yet, if no one is able to take responsibility from the family side, they're going to blame the doctors. That's not the case in this. So I want to give you one example, and I didn't have a chance to talk to you in our CHRIAS website now. So when our patients go to the, let me see if I can just demonstrate very quickly, and I don't want to get away from the topic too much, but if the reason I was on the phone, so then you understand, when you go to our website, I'm going to share my screen in 2 seconds. If you, let's see. So now one of the updates we have is when you go to our website, we had this, we updated this several months ago, schedule an appointment. But then you have to kind of like click on something, and then it's a form. It makes wait time a lot easier, faster, so you don't have to wait too long. And then last week, Dr. Gao, I added this, our web designer added this part, schedule an appointment fast. Like, so when you go, it pops up. So now we have more people opening this. Now, because I was doing this, I was working on this, and I was kind of monitoring how quickly or how much utilization is increasing. So I see some patients putting an inquiry, and some of them put 3-4 times. But mine was a 73-year-old Medicare patient. And we did what we had earlier on the website mainly for our bariatric patients. But we also have general surgery and colorectal surgery. And then the lady said, you know, I'm going to have colonoscopy. I'm like, you're a 73-year-old, so you should be on a schedule for colonoscopy already. So you don't want to just have colonoscopy. Are you having some issues? She's like, yeah, I'm having some issues in the last 6 months. So something is bothering her for the last 6 months. This is a 73-year-old Medicare patient. Mm-hmm. She was lucky that I was on the phone with her. And I said, well, we need to see you right away. And then she's like, oh, I'm going to go away for 2 weeks. I'm like, no, we have it available. I'll make an urgent appointment for you, because if I don't push that, or if she forgets to call us back, and then if we don't act on it in a timely manner, things can get really worse. Mm-hmm. So I said, no, tomorrow we can see you at this time. And then I had my office to verify the appointment, give the address, this and that. She was scheduled with Dr. Babe, and she, whatever she had to do, like whatever her problem was, at least diagnosed at that point. So 6 months late, but it's better than not having it done at all. Right. So in this situation, what bothered me, what made me think of this example is, when did she communicate this problem? Like you mentioned gallbladder and appendix surgeries, which are usually done in the in emergencies mostly, right? And many people, many guys in their 20s, they have appendix surgery. Many people over age 45, they have gallbladder surgeries in emergency. So this is not something that's just for bariatric surgery. Mm-hmm. So this is a scar tissue that can develop and that can start bothering you. But then if we act on it quickly, then or in a timely manner, it could be taken care of. The underlying problem here is the drug abuse, which needs to be discussed heavily, because she apparently was taking like 6 to 12 pills at any given time, and that never stopped. Mm-hmm. So why would this make the headlines as this is a complication of bariatric surgery? Is like the power of the drug cartel, because they don't want this to be known as a drug overdose. It is the media, how their social stigma of obesity, and they are taking, like, she may be the wrong person. Again, we don't want to actually, I want people to understand this correctly. Today, we were going to discuss the risk and complications of bariatric surgery, not her complications, but that's part of our regular, cycle. The reason we are talking about risk and complications, well, for me to leave this office and go to my home in Wilmington, I have to take 95. There is a risk of dying in a car accident. Mm-hmm. That risk is given, right? the chances of that happening is there, but it's not so high. So I'm not going to stop commuting from my office to the home and home to my office. But I have to do certain things. I have to obey the rules. I have to be careful. I have to have a safe car, a lot of other things. So this is the same thing. So what failed in this case is not because there's a complication of bariatric surgery, is the patient not actually following any of the recommendations, including the rehab for drugs. She was never fully covered from drug addiction. So it's kind of interesting how that's not being discussed anymore, but it was before she died. If you check all the news in January, prior to her death on January 30th, it was all about drug addiction. And now all of a sudden, 7 months later, oh, well, actually that's a bariatric surgery complication. So if I'm a patient who finished everything, and then I read this news, because the headline says, well, she died from a bariatric complication, bariatric surgery complication. That's the dumbest statement you can put it out there, but also irresponsible, right? So it's not just dumb, but it's irresponsible. So everything that we say, like just even now, what I say versus what you say, there is a difference because you are a licensed surgeon and I'm not a clinician. I don't have the same obligation that you have, right? So sure. This should be the same way. So we want to, of course, put this out there for to support our patients who are going through the surgery. And we'll discuss a little bit of the other complications related to this. But this is one in maybe how many thousands. We haven't seen this in our practice in the last 20 years.
So we haven't seen somebody pass away from this complication, but we have seen this complication presenting as acutely, right? So patients would have severe abdominal pain come out, they would come to our office, or they would call us, or we would see them in the emergency room, and experienced surgeons recognize very quickly that that is an event of bowel obstruction that is happening with impending potential, what we call ischemia or death of the small intestine. And we take the patients to the operating room immediately. And in the operating room, the goal is to relieve that obstruction and to relieve that twisting of the intestine that is causing the blood supply from affecting the intestine. And in the vast majority of times, the worst thing that can happen is maybe a small portion of the intestine will have to be removed and reconnected, certainly not death of the patient. Now, having said that, Kamal, it is important to reiterate that particularly for certain procedures like gastric bypass, intestinal twisting is a potential complication that can happen in a lifetime of a person after bariatric surgery, 10 to 15% of the time. Now, that occurrence does not mean automatic, bad outcome. It just means that it can happen. It will cause something like abdominal pain to alert the person, right? And that person, if they seek treatment promptly, it is a problem that can be addressed safely by experienced surgeons. What you have really stressed, and it is important here, Kamal, is that substance abuse and bariatric surgery do not go together. That is not a good combination for a number of reasons. And this may be one other reason, in that if you have symptoms and you're less likely to seek help when you have those symptoms, then whatever is causing those symptoms could hurt you significantly. And this would be a type of complication that would absolutely require you to be alert to seek help very quickly, right? As I said, it is a type of complication that it would be unheard of with something like sleeve gastrectomy or gastric sleeve. Why? Because with the gastric sleeve, we are just removing a portion of the stomach, but we are not interfering with the intestine at all. So there is no surgery to reroute the intestine. So this type of complication, if it happens, is seen with something like gastric bypass. And even if it happens with gastric bypass, the outcome that we've seen with Lisa Marie, unfortunately, is something that is really very rare, because even if people have discomfort, Kamal, they will be seeking help quickly. Now, the discomfort doesn't have to be happening days before, Kamal. It could even be hours before the surgery, before the person really being very, very sick. But it is critical that within those hours for the person to seek help. And usually this type of bowel twisting, it's called bowel strangulation, causes so much discomfort, Kamal, that the person is absolutely going to stop anything that they're doing and they're going to go straight to the emergency room in a normal circumstances, which means the person is alert, the person is aware of what's happening, right? But if that person is under heavy sedation with medications or painkillers, then the chances of them seeking that help promptly are lower. And that may have been an issue that you are stressing. And I do agree, if that combination is there, that's an issue. But in terms of us educating our patients about bariatric surgery, Kamal, clearly bowel blockage, bowel obstruction is a potential complication of any abdominal surgery. And then in particular, when people have gastric bypass, where the intestine is rerouted, the chance for the intestine to twist are there just because the surgeon has rerouted the intestine. Does this happen commonly? Well, it can happen up to 10 to 15% of the time. And what's the usual outcome when that happens? The usual outcome is for a person to seek treatment. And when they go to their nearest emergency room and they're met with a surgeon, that problem can be fixed safely so that the person may have an additional surgery, but at least, the problem can be fixed essentially. And that is an important point because, as you mentioned, when you see headlines, a very, very prominent person in the, in the music industry or in Hollywood and other things, passes away at such a young age unexpectedly, and then when people say it was a complication of bariatric surgery, that can raise alarms in people who are planning to have bariatric surgery. But it is obviously important for us to put this in perspective and try to really clarify what the issues may have been, and that this is a very, very rare event where a number of factors have to happen together for this to occur. And what you've mentioned about the substance overuse could have definitely played a role, unfortunately, in the bad outcome from this complication.
It's on one hand, it's kind of, annoying that we have to even discuss this, but on the other hand, for our patients to kind of feel like they're related to Lisa Mary Presley is kind of interesting. So she's not your average person. So her life long lived in shadow of drug and alcohol abuse. She abused drugs from age 13 to 17 until her mother checked her into a Scientology rehab. So I don't think any of our patients have to be checked into a Scientology rehab for drug abuse or alcohol abuse. So her son apparently died from a suicide, and he was only 27 from a drug addiction. Her 2-year marriage to Michael Jackson collapsed with drug abuse. Herself became addicted to opioids in 2008 when she was given short-term prescription from during the recovery from her birth of her twin daughters. Then in 2013, she was heavily abusing cocaine. Then this goes on and on and on. This is not a typical patient. So if she was to, one of the things that we do every day is case conference, bariatric case conference. Why we do it is because that's our way of screening the patients. It's interesting. So one of the patients who texts me today, not that you're going to say, why are they texting me? But just because sometimes I do things that I shouldn't be doing with them, I give them my cell phone number. So I texted him earlier, I guess. So he's like, why do I need to see the cardiologist before the surgery? And then he's like, I just want to take advantage of your message to me. So I have a couple other things with the FMLA and other stuff. Well, I said, you have to see the cardiologist because that's the clearance from the surgery. So we won't do that case unless you have a cardiac clearance. We don't do that unless we check your sleep apnea. We do an EGD. We actually have you seen a psychiatry getting a psych clearance. nutrition visits, and the visit with surgeons, several visits with surgeons prior to the surgery, and the bariatrician who's specialized in this, or your primary care. And that's almost like 12 to 14 checkpoints. And one of the other things that we test, we look into overall wellness of the patient, if whether or not they have, if they are smoking, if they are abusing alcohol or drug addiction. So we wouldn't do the surgery on her in any of our facilities, including the hospital. So this was a wrong choice of the case, and it's not an accident that she died, because the other thing that Dr. Gas, she had a plastic surgery 2 months before she died.
Oh, okay.
No one talks about it. It's just because you have to just go to a lot of gossip pages, and since you didn't know the TMZ until last night, I don't assume that you would know this, but you know, TMZ tells you everything. She had a plastic surgery 2 months before the Golden Globes. So, I mean, yes, I mean, you may want to relate to her because she's a celebrity, but you are not a celebrity, our patients. So don't worry about this. Just follow the instruction that we have, because you won't die from this complication, but you'll die, or your life, quality of your life is going to be limited from morbid obesity. So, which is, you know, which what we discussed for so many years. So, but I can also understand this, like somehow this scares someone, because you know, one of the cool topics that we focus on is the social stigma. So, oh, you're going to have the easier way. You're going to have surgery. No, dumbass. I have like my BMI is 52. So this is my only way to get back to my healthier, you know, life. And you and I and our other providers, our program fights for this. And this was one of those reasons that we want to discuss. Did we miss anything, Dr. Gai? You want to cover anything?
No, I think this is it. I think it's an important topic. Come on, there is no question about that. And I'm glad we are able to talk about it, because we are not only covering the fact that, yes, you know, bariatric surgery is surgery. And of course, like any surgery, complications are a potential. But also, we want to emphasize that in the modern way we perform bariatric surgery in centers of excellence like ours, the level of safety of bariatric surgery is really comparable to many other procedures that are routinely done, whether it's gallbladder surgery, hysterectomy, or knee replacement surgery. And one of the reasons is precisely what you mentioned, is the extent of preparation that really gets patients so well, optimally prepared to undergo anesthesia and surgery that very often anesthesiologists actually will feel more comfortable doing bariatric surgery than any other surgery, just because these patients are so thoroughly prepared. But also the other very important thing, Kamal, is the fact the way the surgery is performed nowadays with small incisions, with laparoscopy, is less likely to cause serious complications like bleeding that used to occur in the past, or even the actual scar tissue itself is much less when you're doing it laparoscopically, because there is less manipulation of the tissue with laparoscopy, where you have these tiny slender instruments that are inserted through small openings to undertake the whole surgery, as opposed to having the full hands of the surgeon manipulating the tissues, you know, with open surgery. So bariatric surgery has achieved a level of safety that is really unprecedented, which has really opened up bariatric surgery to a vast majority of patients. And many primary care doctors actually refer patients without hesitation about the safety of the procedure when they see it appropriate. Having said that, it's also important to understand that complications can happen with any surgery. And one of the things we emphasize in our program is that if our patients have any type of symptoms, that they should let us know, call us, or go to the emergency room if there is no time to do that, or call 911 if the pain is very severe, and things, you know, issues can be addressed and taken care of very, very safely.
Absolutely. Dr. Thank you for joining me today. So
Thank
we'll
you.
be for the next 2 weeks. I'll be out and then be back after that. We are going to continue the new cycle that we started And this discussion, I believe, is for most people, it's clearly there. Hopefully, it reaches out to enough people, not just in our program, but for those who are struggling with the answers and what's the right thing or not. So it's everything that we kind of discussed. As you said, at the end of the day, everyone needs to make their decision, but the standards that we bring into bariatric surgery is extremely high, and this is one of the most efficient ways to fight morbid obesity. And I'm glad that we are able to provide more information for those who are struggling with this. Thank you so much again.